Do you think you need to have diabetes to have peripheral neuropathy? Well, think again. The fact is, you don't need diabetes to develop nerve damage. I'm Dr. Irven with the Neuropathy Doctors, and today we're going to talk about why so many people suffer with burning, tingling, numbness in their feet, even when blood sugar isn't to blame. And more importantly, what's really going on when diabetes isn't the cause. Let's start with why diabetes gets all the attention when it comes to neuropathy. The common belief that neuropathy and diabetes go hand in hand, that only diabetics get this condition. And yes, while diabetes is the most common known cause of peripheral neuropathy, it's certainly not the only one. This is why doctors are trained to check your blood sugar first. But here's the problem. If your numbers come back normal, the investigation usually stops right there. Or you're sent on a wild goose chase, referrals for unnecessary testing that gives you the same conclusion, usually very expensive, very painful, and yet does nothing to treat the symptoms. You're told everything looks fine. You're sent on your way, still burning, still tingling, still numb. Part of the reason that diabetic neuropathy gets all the attention is that is what insurance companies are built around. Their guidelines are centered on blood sugar management. So once you're ruled out as a diabetic, most doctors don't have a covered path forward besides more testing. They're not incentivized to dig deeper. And the truth is, non-diabetic neuropathy doesn't get studied nearly as much. Take, for instance, when you do these studies, you have to have a control group. Understand, the only thing that you can put up as a control group against diabetics who have neuropathy are diabetics. So you, as a non-diabetic sufferer with neuropathy, you're not even part of that research. So it's under-researched, underfunded, and largely ignored by traditional medical training. What this means is that millions of people are left in this gray zone. Symptoms are real, but there's no clear diagnosis, no standard treatment plan. What we're seeing now is that non-diabetic patients are being diagnosed as borderline diabetics and being put on diabetic medication when all of their testing has indicated that they're not diabetics. It's what they have left. It's the only thing they know to do. And that's exactly where so many of our clients have come from. But here's what we see every day. People with real neuropathy and no diabetes, and their symptoms are just as intense. So what else causes it? Let's break that down. One big cause we see are spinal issues, particularly in the low back. If the nerves are being pinched in the lumbar spine, you can feel pain, tingling, numbness in your feet, and it has nothing to do with blood sugar. Approximately 60% of neuropathy cases have some sort of low back component, whether that be spinal compression, degeneration, stenosis, or even muscles that are so out of balance with one another that they begin to create impingement on those nerves. Another one, toxins, chemotherapy. Even if it was years ago, chemotherapy can cause long-lasting nerve damage. And for people who are still taking cancer medications, until those are cleared out of the system, your neuropathy symptoms will keep getting worse. We also see circulatory issues. When nerves aren't getting enough blood flow or oxygen, they slowly become dysfunctional and deliver poor signals to the brain. On top of those causes, it's really common for our clients to come to us with either chronic inflammation from autoimmune disorders, poor gut health, even side effects from certain medications like statins or blood pressure meds. There are so many causes, and yet most people only get tested for one. Here's the kicker though. In almost all of the clients we help, we're able to pinpoint multiple causes, which is exactly why the monotherapy approach, one gadget, one drug, one vitamin, creams, all of this is an abject failure when it comes to getting real results and lasting results. So if that's you, if you've got all those symptoms, but you're not a diabetic, what should you do? First, know this. You are not broken and you are not alone. A huge number of our clients don't have diabetes, but they still deal with the burning feet, tingling toes, numbness, cramping, swelling, all of it. The key is to look deeper. Don't settle for the labs are normal. That doesn't mean nothing's wrong. The goal is to treat the nervous system, not the numbers. You need a full system approach. Most people improve when they support all the things nerves need, regardless of the original cause. And once you give your body what it actually needs, circulation, stimulation, nutrition, consistency, you will be amazed at what is possible. So if you're not a diabetic, but your feet are burning, tingling, or going numb, you're not alone. And you're definitely not out of options. Neuropathy has many causes. Diabetes is just one. The key is asking better questions and looking at the full picture. If this video has helped you understand your symptoms just a little better, then please show us a little love, give the video a thumbs up, subscribe to the channel. We post new videos like this on a regular basis to help people better understand their neuropathy and take control of it rather than it taking control of you. We'll see you next time.
Did you know there are signs, actual clues that suggest that your neuropathy can get better? We've worked with thousands of clients across the country, and we've noticed that the people who get better have these 6 signs in common almost universally.
So if you're feeling discouraged or overwhelmed by the numbness, burning, tingling, or pain from neuropathy, this video might be the encouragement that you need.